Hello, my name is Emily Zare, and I am a student physical therapist at the University of Missouri. Today we'll be discussing the role of virtual reality and other video games in reducing the requirement for opioid use in children with burns. Throughout the years, many children as well as adults have lost their lives at the hand of opioids. This has led to extreme scrutiny when it comes to prescribing opioids for pain management in children. It is also important to understand that there are currently no guidelines for the appropriate prescription of opioids in the pediatric population. More research must be conducted on the risk-benefit ratio of prescribing opioids in pediatric patients. Opioid prescription following burns in pediatric patients has been demonstrated in research due to the intense pain caused by dressing changes, as well as overall treatment following burn injuries. Undertreatment of pain associated with burn injuries can lead to post-traumatic stress disorder as well as longer hospital admissions. It is important to weigh the risks as well as the benefits when determining if opioid prescription is the best treatment strategy. In a study conducted in 2020, only a small portion of the pediatric patients were prescribed opioids for pain management. The patients who did receive opioids tended to have more severe burns covering a much larger portion of their body. Of the small portion of patients who did receive an opioid prescription, not all the parents filled this prescription, and barely any of the patients used the entire prescription. Many patients instead relied on the use of over-the-counter pain medications. Patients took acetaminophen as well as NSAIDs and even relied on non-pharmacological therapies such as virtual reality, games, music, and animals as a distraction from the pain. In these patients with less severe burns, over-the-counter painkillers as well as non-pharmacological therapy proved effective in reducing pain. In patients with more severe burns, as well as patients who are at increased risk of bleeding from debridement and are unable to use NSAIDs, opioids were prescribed. Of the patients who were prescribed opioids, the parents reported they were not informed on the proper storage or disposal of the opioid prescription. For pediatric patients who require the use of opioids, implementing protocols on patient education regarding opioid use and disposal is a requirement. The switch to the use of over-the-counter painkillers as well as non-pharmacological therapy is an important step to decreasing the use of opioids. Virtual reality has been used as a distractor in the treatment of pediatric populations with burns. Virtual reality can be implemented by physical therapists to reduce pain, reduce anxiety, as well as improve range of motion in pediatric burn patients. Virtual reality is used throughout the physical therapy session to provide the patient with pleasant images and videos to serve as a distraction. While the child is viewing the 3D virtual videos and listening to calming, relaxing music, the physical therapist can implement the passive range of motion exercises as well as stretching exercises. In individuals who received the VR distraction, patients reported a decrease in pain throughout the treatment session. Patients reported having fun, which was found to be correlated with a decrease in anxiety surrounding dressing changes as well as other therapeutic interventions. The decrease in pain was also shown to lead to the requirement of less medical intervention. Virtual reality was also demonstrated to increase range of motion in comparison to the control group. The studies also found that virtual reality led to faster tissue recovery and in turn decreased the hospital stay, which in turn decreased hospital costs overall. The use of virtual reality has been shown to have a wide array of positive effects on the treatment and healing process of pediatric burn patients. So what is virtual reality? Virtual reality is a fully immersive, three-dimensional experience. A virtual reality system usually consists of a headpiece that covers the eyes, as well as two handpieces. When it comes to pain management, the more involved the patient is, the greater the distraction. Virtual reality serves as a great distractor because it is three-dimensional and fully immersive. Research has been conducted on the effectiveness of other video games in pain management. The results seem promising when it comes to devices such as the Wii or Nintendo. When it comes to the cost of virtual reality, it can be very variable. Prices can range anywhere from $100 to $1,000 plus. I've provided two links that will supply you with two separate resources to compare and contrast different VR prices. And once you have the VR system, there are a couple of resources you can use that have been specifically tailored for therapy and pain management. One resource is called Snow World. Snow World is free to download and is a three-dimensional experience specifically designed for the treatment of children with burns. Another resource I have provided is called Ditto. The diversionary therapy technologies consists of a variety of games specifically designed to distract children and help manage pain. So I just wanted to leave you with a short summary of my presentation. So opioid prescription was more common in patients with severe burns covering a large surface area. In cases such as these, the excruciating pain might warrant the use of opioids. Parents consistently reported being undereducated on how to store and dispose of opioids. Physical therapy can play an important role in educating parents on the proper storage and disposal of these drugs. Parents could be provided with pamphlets on this information, or physical therapists could take a more active role in directly educating parents and answering their questions by utilizing the teach-back method. In patients with less severe burns, over-the-counter painkillers were commonly utilized to manage the pain, along with non-pharmacological therapies. One such non-pharmacological therapy is virtual reality. Virtual reality was shown to decrease pain and anxiety while improving range of motion. Once you purchase your virtual reality system, there are several resources you can utilize that are free to download. Snow World and Ditto were specifically designed to be used as a distractor from pain and decrease pain throughout the therapy session. So I just wanted to thank you so much for watching my presentation, and I hope you learned a little bit more about the use of virtual reality in decreasing pain in children with burns. Thank you.